Now, the matter is selected for topical issues. The first one is in the name of Deputy Paudie Coffey to the Minister for Health, and it's on the need for 24/7 critical cardiac intervention services for the South East region at Waterford Regional Hospital. And the Deputy is here in his 4 minutes.
Thank you, Lasca Hirlock. Minister, I want to raise this issue, which is indeed a topical issue at the moment, but it has been a topical issue for many number of years in the Waterford and the South East region. And that is the issue of the availability of 24/7 invasive cardiology services at Waterford Regional Hospital, which is soon to become Waterford University Hospital. Now, at the outset, I do want to acknowledge that great progress has been made in regard to this service, which provides essential emergency services for invasive cardiology treatment in the event of a heart attack for the people of the South East region. As you know, Minister, there is a population of almost 500,000 in the South East region. And in the event of a critical heart attack, Waterford University Hospital, as it now will be known, is the closest location for invasive treatment. Now, I understand that in 2008 the cath lab unit at Waterford Regional Hospital was opened, and at that stage it was only open 2 days per week. At the present time, I understand it's open 5 days per week from 9 to 5 p.m. And the main concern is that in the event of a heart attack of a citizen or a person in the South East region, outside of hours, in the evening or indeed at weekends, that these vital services are not available to them. And you know, we talk all the time about equality in politics and equality in society. Well, I would contend that this is equality in terms of the access to health services for citizens that live and reside in all parts of the country. If you live in Dublin, Cork or Galway, you will indeed have 24/7 access to these types of services. If you live in Waterford or in the South East region at the present time, in the after hours, you do not have access to these vital services. And I'm calling on the government, and I'm looking for reassurances here today, Minister, that indeed commitments were made that this regional service, first of all, would be retained. There was a lot of concern when the reconfiguration of hospital services was announced some time ago, and commitments were made that, you know, regional services such as this would be retained at Waterford Hospital. Now what I'm looking for also is reassurances that we are moving along and that there is a genuine effort being made by the HSE, by the government and by those in the Department of Health to deliver this vital service, as I said, for equality of access for health services for citizens in the South East. Essentially, Minister, what I understand is needed is a second cath lab and additional consultants with the supporting staff. And I'm hopeful that you will be able to respond to me in the positive here today in the Dáil, as I carry this message from Waterford and the South East region, this genuine concern from people that want this equal access to vital services. Thank you, Las Concorla.
Thank you very much, Deputy. On behalf of the Minister for Health, I would like to thank you for raising this issue and affording the Minister the chance on the record to reply. In the context of the implementation of the hospital groups, the range of services currently available in Waterford Regional Hospital, including coronary care, will be retained and enhanced. The Cardiology Department of Waterford Regional Hospital provides the regional service for some 500,000 people and offers a comprehensive range of invasive and non-invasive diagnostic services. The House will acknowledge that considerable achievements have been made since the Waterford Regional Hospital Cardiology Interventional Suite opened in May 2008 on a 2 days per week basis. In October 2009, the service was extended to a 5-day-week service, which incorporated a dedicated 6-bedded cardiac day ward. I should also note that the Regional Cardiac Catheterisation Laboratory in Waterford Regional Hospital provides equal access to services from the 4 acute hospitals within the region. Since its establishment, the laboratory has provided access to cardiac angiography and complex cardiac cases for 8,255 patients and 11,890 procedures. These patients would otherwise have had to travel to either Cork or Dublin to receive such services. In 2013, 1,709 patients were seen and 2,404 procedures were undertaken. Patients presenting with an acute myocardial infraction to Waterford Regional Hospital can now receive emergency percutaneous coronary artery intervention to open the blocked artery immediately and limit the damage to the heart muscle. Since October 2012, the Waterford Regional Hospital Interventional Suite has been identified as the designated primary percutaneous coronary intervention centre as part of the National Acute Coronary Syndrome Programme covering Waterford, Kilkenny, Wexford and indeed South Tipperary. Minister Riley understands the Waterford Regional Hospital intends to develop a fourth consultant post as part of the hospital's operational plan for 2015. Furthermore, a business case to extend the opening hours of the cardiac catheterisation laboratory is being prepared by the hospital with a view to the provision of 24/7 primary PCI and development of a second cardiac laboratory. Again, my thanks to the Deputy for raising this issue. The establishment of hospital groups is a key building block in the delivery of the programme for government commitment to fundamentally reform our health services and will provide the optimum configuration for hospital services to deliver high-quality, safe patient care in a cost-effective manner. Waterford Regional Hospital, as a key hospital within the South-South-West Group, will have significant links to the Group's academic partner, University College Cork, which will provide opportunities for sharing of experiences and expertise, as well as furthering their research agenda. Thank you.
The Deputy has 2 minutes for a supplement.
Thank you, Las Cathaoirleach. I wish to thank the Minister, first of all, for his reassurance that the current services at Waterford Regional Hospital will be retained and indeed enhanced. That will be a reassurance to the people of the South East region. I also note the commitment, again stated by the Minister here on the Dáil, that since October 2012, that the interventional suite has been identified as the designated primary coronary intervention centre as part of the National Acute Coronary Syndrome Programme covering Waterford, Kilkenny, South Tipperary and Wexford. And Minister, I understand it's international best practice that in the event of a heart attack, the most effective treatment, according to cardiologists, is angioplasty because it significantly lowers mortality, it decreases shock and it lowers the risk of stroke and gives a better longer-term outcome. But that intervention must be delivered within 90 minutes of an attack occurring. And that is why it is so important for all the people. This is not just a Waterford issue, the people that I represent. This is an issue for the region. This is an issue for the people living in Kilkenny, Wexford, South Tipperary and Carlow, that they would have a 90-minute space that access to these vital services is available at this hospital. And I welcome the commitment again here in the Dáil that the Government is intent on delivering a 24/7 cardiology service over time at Waterford Regional Hospital. Thank you very much.
Thank you, Deputy. Do you want to respond, Minister?
No, just to reassure the Deputy that there is an intention in the hospital to develop a fourth consultant post as part of the operational plan into 2015, and the business case to extend the opening hours is being prepared for the hospital with a view to opening the said 24/7 requirements, and we look forward to that development.
Thanks very much, Minister. And the next topic